Hi everyone, we're going to talk a little bit about Crohn's disease. Crohn's disease is a digestive disorder that causes inflammation and swelling of the digestive tract, especially in the gastrointestinal area. The part that's most affected is the small intestine, which is called the ileum. The GI tract is composed of a series of organs joined in a long twisting tube from the mouth to the anus. The movement of the muscles in the GI tract, along with the release of hormones and enzymes, allows for the digestion of food. In Crohn's disease, inflammation extends deep into the lining of the affected part of the GI tract, causing swelling and pain, and can make the intestine empty frequently, or have the dumping syndrome that results in diarrhea. It can be chronic or long-lasting. It can produce scar tissue that builds up in the intestine and can cause strictures. Crohn's disease usually is equal among men and women who get it. Also, it's usually between the ages of 13 and 30, although any age can get Crohn's disease. It is part of the family of bowel disorders, irritable bowel syndrome, or ulcerative colitis. Also, people of Jewish heritage have a higher increase of acquiring the disease, and African Americans have a low risk of acquiring the disease. The cause of Crohn's is unknown. Many believe that it's a result of an abnormal reaction of the body's immune system to the GI tract, because your immune system is primarily in your digestive tract. Also, some of the symptoms of Crohn's disease, the person can experience rectal bleeding, weight loss, fever, diarrhea. Also, they can be anemic because of bleeding in the intestinal tract. And there are also other range of severe symptoms that can vary. Crohn's disease is diagnosed by blood test, stool test, also doing a colonoscopy or sigmoidoscopy. A flexible sigmoidoscopy can help determine the extent of damage, if there is damage, and see how far along the GI tract that is affected by the disease. Also a CT scan done by using the dye, by giving the patient a drink, and then that gives them the ability to diagnose the disease also. And they also do upper GI and lower GI series to determine if the patient is suffering from Crohn's disease. Some of the complications from Crohn's could be fistulas, formulation of fistulas. It can often become infected and usually are in the anus or the rectum. You can also have small tears called fissures that develop in the mucous membrane of the anus. For this, they're usually prescribed topical creams that help soak the affected area. That helps you help the affected area, and you can also soak it with warm water. Crohn's disease complications also occur because of the diseased area of the intestine does not absorb nutrients properly. So there's a deficiency usually in protein, calories, and vitamins when the person has Crohn's disease. It also causes anemia, which is usually caused by iron deficiency. Because of this, a lot of people with Crohn's disease will suffer from a lot of fatigue. Children with Crohn's may fail to grow normally and have a low height for their age. Also, some of the complications of Crohn's can result from the medications used to treat the disease, such as steroids. The long use of steroids can weaken the bones, cause osteoporosis or osteomalacia. Also, some people with Crohn's disease develop restless leg syndrome, and it basically is sitting or lying down. It's impossible for their legs to relax completely, which can result in loss of sleep, and then of course with loss of sleep can come loss of quality of life. Other complications that can occur are skin problems, kidney stones, gallstones, arthritis, and diseases related to liver function. Treatment for Crohn's is in medications, most commonly immunosuppressants are used. Anti-inflammatory medications are used to get the swelling down. Immunosuppressants, of course, to suppress the immune system so it can start attacking the GI tract. Also, there are biological therapies such as skin injections of Humira, biological therapies of substances that block the body's inflammation process. Also antibiotics to treat when the small intestine causes strictures or fistulas. And antidiarrheals also used, and also fluid replacement, because with how the bowel reacts, adding more fluid to the bowel tract will help the person, especially when it comes to diarrhea, because they will become dehydrated, and then that will cause even more problems. Worst case scenarios, Crohn's disease will lead to surgery, where they might have to take part of the intestine out and place an ileostomy. Also, they might have to do a resection or anastomosis of the bowel if that part of the bowel becomes too diseased and starts to die. Also, interestingly, Crohn's disease often can recur even after surgery. So people that consider surgery, they should weigh the benefits to the risk. And the way to do that is to get information from your care provider, and also do extensive research on intestinal surgery and to see if it works for you. Another major component of Crohn's disease regulation is through nutritional supplementation, because of the fact that their GI system does not absorb the nutrients that they need. It is highly recommended that they take in high-calorie foods, particularly special liquid formulas that will help them to boost their protein levels, their vitamin D levels, calcium levels, etc. Also, patients with Crohn's disease should avoid any meals or foods that they discover exacerbate their disease, and some of these usually could be hot spicy foods, milk, or alcoholic beverages, because it can create cramping in Crohn's disease. Also, a patient needs to know that smoking can make Crohn's disease worse. Also, due to the complications of the disease and the high dose steroids and medications a person is usually on, sometimes the smoker can render those medications useless, because the body doesn't absorb them or take them in as well as they could, because smoking usually can cause restriction in the blood vessels. Quitting smoking can greatly improve the Crohn's disease flare-ups that a person may have. Also, stress is one thing that people have assumed can cause Crohn's disease, but there's no evidence that shows that this is the case. Some people may find that there's a correlation between higher stress level and worsening symptoms, but the healthcare FDA has suggested that this is not a contributor to Crohn's disease exacerbation. Also, some things that are important to remember is that it does cause inflammation and swelling and irritation of the tract. Men and women both get it equally. Disease causes unknown. The most common symptoms are abdominal pain and diarrhea, which can therefore make it hard to diagnose, because it mimics so many other digestive issues. Several tests can be used to diagnose Crohn's disease. Most common complication of Crohn's disease is intestinal blockage, and which can result in having surgery or in some type of related interventional interior rectification process. The Crohn's disease medications can also cause problems with the patient, but the doctor can find the right combinations for the person with Crohn's disease to help them to live a healthy and quality life. Make sure the diet is in accord with standards that will prevent exacerbations and flare-ups. Also, stress, although they do say it's not a major contributor, it's always good to lower the stress level in a person's life. Also, there's plenty of research going on about Crohn's disease, and the National Institute of Diabetes and Digestive and Kidney Diseases, the Division of Digestive Diseases and Nutrition are just a couple of the organizations that are trying to develop further research into the condition of Crohn's disease and how the patients who have this can be helped. The next video contains just a general abdominal assessment, but it's something that would be used on a patient with Crohn's disease as well. You will percuss, auscultate, palpate, check for any abnormalities of form of the abdomen and so on, and this will help you determine where the pain is, how extensive the pain is, and what needs to be done from there. So enjoy, and don't forget to watch the next video. Thank you.